All right, everyone, get ready for a deep dive today
Buckle up.
into a topic that's
Yeah,
pretty fascinating, but it can get a little complex. We're talking about parathyroid carcinoma,
that's right.
and we've got some great medical texts here that we're going to be breaking down.
Absolutely.
And whether you're just curious about this or you actually need to know this stuff for your work, you're going to find something interesting here.
Definitely. It's often overlooked because it's so rare,
Right.
but it has a huge impact on patients.
Yeah, and speaking of that rarity, we should probably start there.
Good point.
I mean, we're talking about less than 1%
Right.
of all hyperparathyroidism cases
Less than 1%.
actually developing into this type of cancer.
Yeah.
In fact, one of the studies that we looked at, they had over 4,000 patients,
Wow.
and only a tiny fraction, like 2.1%, actually had parathyroid carcinoma.
That's tiny.
Is it?
But what's interesting is that even though we're seeing more cases diagnosed, it's probably not because the cancer itself is more common,
Right.
but because we're getting better at finding it.
Finding it early?
Early, yeah.
That's a win.
That is a win.
Okay, so before we go too far, let's back up a little bit because some people might be listening and thinking, wait, what even is hyperparathyroidism?
Right.
We need to make sure everyone's on the same page so
Yeah.
they understand why this carcinoma is such a big deal.
Absolutely. To put it simply, it's when the parathyroid glands, those little guys in your neck, decide to go into overdrive.
Workaholics.
They work too hard, producing too much parathyroid hormone.
Yeah.
And that usually comes from a benign tumor. It's called an adenoma.
Okay.
But in those very rare situations, it's actually a carcinoma running the show.
Oh, so it's not just overactive. It's actually, there's a bad actor in there.
Right. And that overactivity leads to way too much calcium in the blood, and that can cause all sorts of issues.
And that's where parathyroid carcinoma really comes in and makes things a lot worse. We're not talking about just feeling a bit tired here, are we?
No, not at all.
This carcinoma, it's like it takes all those symptoms of regular hyperparathyroidism and amplifies them.
Exactly.
And the scariest part is that by the time they're diagnosed, up to a third of patients are already dealing with metastases,
Scary.
which means the cancer is already spread.
Yeah, it really highlights how serious this is. And we're not kidding about those symptoms being intense.
So spill the tea. How bad does it get?
Their calcium levels are through the roof. We're talking averages between 14 and 16 milligrams per deciliter.
Wow.
So yeah, those typical hyperparathyroidism symptoms, they're not messing around.
So it's got to be really impacting their daily lives. The study even mentioned that a whopping 73% of patients had bone disease.
That's a lot, yeah.
That's like 3 out of 4 people with this cancer having to deal with some serious issues with, just moving around.
That's right.
And on top of that, they have kidney problems just as frequently.
Yeah, and again, all because of that super high calcium.
And then on top of all that, a significant number of patients, they even develop pancreatitis.
Which is a serious inflammation of the pancreas.
Right.
But here's the real kicker. A small percentage, somewhere between 2 to 7%, have no symptoms at all.
So you could have this and not even know it.
Exactly, which is why awareness is so crucial. Early detection is really key.
Okay, well, we've established that this is serious business, so let's break it down. What's actually happening at the cellular level to cause this cancer? Can we talk about that without getting too sciencey?
Of course. The main culprit, the one we know the most about, is a gene called HRPT2.
Okay.
Think of it like the cell's guardian, keeping everything in check. It's a tumor suppressor.
Oh, so it's like a superhero gene?
Yeah, you could say that, but when it gets mutated, it's like its powers are gone and things can spiral out of control.
Oh, no.
And to make things even more interesting, this gene is linked to a really rare syndrome.
And what syndrome?
It's called hyperparathyroidism jaw tumor syndrome,
Whoa.
or HPTJT for short.
HPTJT.
Got it. People with this syndrome, they have a much higher chance of developing parathyroid carcinoma, sometimes as high as 15%.
Wow, that's a big jump.
It is. And most of these mutations in this HRPT2 gene, they're what we call somatic.
Somatic. What does that actually mean?
So it means the mutation isn't something you're born with.
Oh, okay.
It happens in a person's cells throughout their life. It's like a typo in the gene's instructions, but just in specific cells, not the whole body.
Okay.
And what this tells us is that these mutations are actually helping the cells survive, almost like they're choosing to become cancerous.
That's kind of creepy.
Yeah, it's like those cells are going rogue. Now, there might be other genes involved, but right now, HRPT2 is the main one on our radar.
The main villain.
Exactly.
But diagnosing this, it's not as simple as just running a blood test, is it?
Unfortunately, no.
There's no easy answer.
Not yet, at least. A biopsy can show some things that raise a red flag, like a particular cell pattern called a trabecular pattern.
Right.
But the thing is, these patterns can also show up in benign tumors, so it's not a clear-cut answer.
Right.
The only way to know for sure is if we find evidence that the cancer has spread into nearby tissues or to other parts of the body.
So basically, the diagnosis often comes late in the game when the cancer's already advanced.
It often does, unfortunately.
That's not good.
Not ideal.
So let's talk treatment then. Surgery seems like the first line of defense, but it's probably not as simple as just taking the gland out.
You're right. The most effective approach is an en bloc resection, which means taking out the tumor and anything around it that it might have touched.
So we could be talking about removing parts of the thyroid, lymph nodes, even pieces of muscle.
It's possible.
And what about that recurrent laryngeal nerve?
That's the tricky part.
Yeah, that one sounds a bit scary.
It is a very delicate procedure. That nerve controls your vocal cords, so if it's damaged, you could lose your voice.
Oh, wow. That's a big deal.
And if they find the cancer after the first surgery, they might need to operate again.
I imagine that comes with its own set of risks.
Absolutely.
Yeah.
There's a higher chance of complications, like damaging that nerve again and ending up with vocal cord paralysis. One study showed that reoperations had a 32% complication rate.
32%? That's a lot.
It is.
It really makes you think about how serious these surgeries are. And even when they say the surgery was successful, the journey's not over.
Right.
We read about something called hungry bone syndrome that can happen after surgery.
Oh, yes. After they take out the tumor, the body has to figure out how to deal with normal calcium levels again. Imagine your bones have been starved of calcium and vitamin D for so long.
Right.
They go into overdrive trying to soak up everything they can.
So, wait, you go from fighting high calcium to suddenly needing more of it.
Yeah, it's kind of strange, isn't it? Shows you just how complex this disease is.
It really does. And then, of course, there's always the worry about it coming back.
Recurrence is a big concern, and it's why regular monitoring is so important.
And sadly, sometimes they have to do more surgery to deal with those metastases, even if it's just to help with the symptoms.
That's right.
So surgery is clearly a big part of this whole thing. But what if they can't do surgery? What happens then?
Well, then the focus shifts to controlling those high calcium levels. There are medications called calcimimetics, like cinacalcet.
Okay.
These can help reduce how much parathyroid hormone the body makes.
But there's got to be a downside, right?
There usually is with medications. Side effects are pretty common, things like nausea and vomiting.
Yeah, not fun.
Not fun at all. It's all about finding a balance, managing those symptoms without making things worse with side effects.
Finding that sweet spot.
Exactly.
Yeah.
There are also bisphosphonates like pamidronate or zoledronic acid, which is stronger.
What do those do?
They protect the bones from the damage high calcium can cause.
Oh, that's good.
It's like having different tools for different parts of the problem.
And while the doctors are figuring out the best course of action, I bet the question of what's next is weighing on everyone's mind. The prognosis,
Of course, that's a natural concern.
it's got to be scary not knowing how this is all going to play out.
It is, and unfortunately, there's no easy answer when it comes to parathyroid carcinoma.
It's not like a fortune cookie where you crack it open and it tells you your future.
I wish it were that simple. It depends on a lot of things, like how early they caught the cancer, how aggressive it is, the person's overall health, how well they respond to the treatment, all of that.
So everyone's journey is different.
Exactly.
But are there any patterns we see? Are survival rates getting any better?
There is some good news there. The rates do seem to be improving, but the data we have is still limited.
Right.
The older studies showed a 5-year survival rate between 50 and 70%.
So that means that as many as half the people diagnosed didn't make it past 5 years.
Sadly, yes.
That's pretty heavy.
It is. But newer studies, they're reporting rates over 80%.
Wow. That's a big difference.
It's a significant improvement. It could be from earlier diagnoses, better surgeries, better supportive care, maybe even just better data collection. It's hard to say for sure.
But at least it's moving in the right direction.
Definitely. The bottom line is, the earlier we find and treat this cancer, the better the chances are.
And that brings us back to the HRPT2 gene and why testing for it is so important. Remember how we were talking about that connection to HPTJT?
Yes.
Doctors recommend testing for this gene in most patients diagnosed with parathyroid carcinoma, even if there's no family history.
That's right. They might have HPTJT without knowing it, which puts their family at risk too.
Oh, so it's not just about the patient themselves, it's about their whole family.
Exactly. Finding a mutation in this gene, it changes everything. How doctors approach the treatment, how they monitor the patient in the future, everything.
It's like a domino effect.
It is.
But what if the test comes back negative? Does that mean everyone can relax?
It's good news, but it's not a 100% guarantee. Mutations can be sneaky and hide in other parts of the gene that the test might miss.
So even with a negative result, you still need to stay aware of any possible signs or symptoms.
Absolutely. But let's say the test comes back positive. What does that mean for the patient and their family?
That's a big question, and unfortunately, we're out of time for today.
But we'll pick up right here next time and delve into what a positive HRPT2 test result means and how living with this genetic risk can impact families.
So be sure to tune in for part 2 of our deep dive into parathyroid carcinoma.
We'll see you then.
Welcome back. So last time, things got pretty intense as we were learning about parathyroid carcinoma. We left off talking about the HRPT2 gene test and what a positive result could mean, especially for families.
Yeah, it definitely adds another layer of complexity, doesn't it? It's not just about treating one tumor in one gland anymore. It's like all the parathyroid glands become suspects.
Like a cellular mystery.
Exactly.
So how do surgeons approach this? Do they just take them all out just to be safe?
Well, that's where it gets tricky. There's no easy answer. Some experts say yes, take out all 4 glands, total parathyroidectomy to make sure no new tumors pop up. But it's not a decision to be made lightly.
Because then you're basically trading one problem for another, right? You get rid of the cancer risk, but then you have to deal with hypoparathyroidism forever.
That's the trade-off. You'd need lifelong hormone replacement therapy. It's a tough call, weighing the risk of more tumors against having to manage the hormone issue for the rest of your life. Each case is unique, so doctors have to consider the patient's age, their health, their preferences, everything.
I bet those conversations between doctor and patient can be pretty heavy.
They can be, but it's all about working together, making sure the patient understands the risks and benefits so they can make the best choice for themselves.
And we can't forget about the families. A positive HRPT2 test result, it doesn't just affect the patient. It brings their relatives into the picture too.
You're absolutely right. Genetic counseling becomes really important at that point, helping families understand what this all means.
Right, because suddenly it's not just one person's health, it's a whole family's concern.
Exactly. They need clear information about the inheritance patterns, what the risks are, what testing options they have, so they can make informed decisions for themselves.
So it's like a chain reaction, starting with one diagnosis and then potentially affecting decisions for the whole family.
It can be, but what happens when someone in the family decides to get tested? What do those results mean for them?
Right, that's the big question.
Well, a positive result means they've inherited that HRPT2 mutation. So their risk of developing parathyroid problems, including carcinoma, is higher. They'll need to be monitored regularly with blood tests to check their calcium levels, and they might need imaging scans to keep an eye on those parathyroid glands.
That must be a lot to take in, knowing you have this increased risk hanging over you.
It can be, but the good news is that if they find it early and manage it properly, people with this gene mutation can still have a good outlook.
And what about those who test negative?
That's a big relief, of course. A negative result means their risk is much lower, and they usually don't have to worry as much. They might still need some basic monitoring, but it wouldn't be as intense or frequent as someone with a positive result.
So genetic testing, it's a double-edged sword, right? It can either confirm a shared risk or give you peace of mind.
Exactly. It's all about giving people the information they need to make choices about their health.
And even if they don't get genetic testing, maybe they choose not to, or maybe it's not available to them, it's still important for family members of someone with parathyroid carcinoma to be aware of the potential risks.
Definitely. They should be proactive, talk to their doctor, get those calcium levels checked, and just stay on top of things.
Right. Better safe than sorry.
Yeah.
Especially with something as rare and potentially serious as this.
Exactly. Knowledge is power, as they say.
Speaking of knowledge, we've covered a lot about parathyroid carcinoma today, from diagnosis and treatment to genetics and family implications. But there's one big question that's been on my mind. What's the long-term outlook for someone with this diagnosis? What can they expect down the road?
I understand why you'd ask that, and honestly, it's not a simple answer. It really depends on a lot of factors. The stage of the cancer, when it's found, how aggressive it is, whether the surgery was successful, the person's overall health, how well they respond to treatment. It's different for everyone.
So there's no way to predict exactly what will happen.
Unfortunately, no. It's not a one-size-fits-all situation. Some people are cured after surgery and never have to think about it again. Others might have it come back and need more treatment, and for some, it can be more aggressive.
So everyone's journey is unique.
Exactly. And that's important to remember.
But are there any overall trends? Is there any good news about survival rates?
There is some good news. The survival rates do seem to be getting better, but the research is still ongoing. Older studies showed a 5-year survival rate somewhere between 50 and 70%.
So half the people diagnosed might not have lived past 5 years.
That was the reality back then, yes. But newer studies are showing rates above 80%, which is a big improvement.
That is good news. So what's causing this improvement?
It's hard to say for sure. Maybe it's because we're finding it earlier, maybe the surgeries are better, maybe the supportive care is better, maybe we're just collecting better data. It's probably a combination of things. More research will give us a clearer picture.
But at least it's a positive trend.
Definitely. And it just emphasizes how important early detection and treatment are.
For sure. So one thought that's been bugging me throughout this whole deep dive.
Okay, what is it?
We know this is a rare cancer,
Yeah.
but we're seeing more cases now.
Hmm.
Could there be something else going on, something we haven't figured out yet that might be contributing to this disease?
That's a great question, and to be honest, it's something researchers are looking into right now. We know that better detection methods are finding more cases, but it's possible there are other factors, things in our environment or our lifestyles that we haven't identified yet.
Like missing pieces of a puzzle.
Exactly, and this just highlights how important it is to keep researching. We need to understand the biology of this cancer better, explore those potential environmental triggers, and develop more effective treatments with fewer side effects.
And maybe someday we can even prevent it altogether.
That would be the ultimate goal, wouldn't it? But until then, the best weapon we have is awareness. The more we understand about parathyroid carcinoma, the better equipped we are to fight it and support those who are affected by it.
So if we could sum up everything we've talked about today into one key takeaway for our listeners, what would it be? What's the one thing you want them to remember?
Be proactive about your health. If you have any concerns about your parathyroid, even if they seem small, don't hesitate to talk to your doctor. Early detection is crucial for parathyroid carcinoma. It can make a huge difference in how well the treatment works and what the long-term outcome is.
It's about being your own advocate, being informed, and not being afraid to ask for help.
Exactly. And remember, knowledge is power, but it's compassion and connection that help us get through tough times.
Well said.
Yeah.
And now, before we wrap up this part of our deep dive, there's one more important aspect of parathyroid carcinoma we haven't talked about yet.
Oh, what's that?
We focused a lot on the medical side of things, but we can't forget about the emotional and psychological impact this disease has on patients and their families.
You're absolutely right. That's a huge part of the journey, and it often gets overlooked.
So join us for the final part of this deep dive as we explore the human side of parathyroid carcinoma, the challenges, the coping mechanisms, and how important support systems are. Welcome back to the deep dive. It feels like we spent ages unpacking this whole parathyroid carcinoma thing.
It is a complex topic.
It really is, from the science to the treatments, the family stuff.
Right.
But now we got to shift gears a little
Yeah.
and talk about something that's just as important, I think, the human side of it all.
Absolutely. It's easy to get lost in the facts and figures and all the medical stuff. But at the end of the day, there's a person behind every diagnosis. A whole family, actually, facing a ton of emotions.
Right. It's not just about the physical symptoms.
No.
It's the fear,
Yeah.
the uncertainty.
The what ifs.
Yeah, how this whole thing just throws a wrench into your life.
It's a huge adjustment. Imagine getting that diagnosis. Everything changes in an instant. You're dealing with a rare disease, potentially a big surgery, and you don't know what the future holds.
It's scary.
It is.
And it's not something you go through alone. It affects spouses, partners, kids, parents, friends.
Everyone.
Everyone's on this journey in some way.
They are. And they're dealing with their own emotions, too.
Of course, there's worry. There's that feeling of helplessness, watching someone they love go through something so difficult.
Yeah, and they might have to take on new responsibilities, become caregivers, figure out a new normal. Sometimes it's hard to balance your own needs with the needs of the person you're caring for.
It's like this ripple effect,
It is.
touching everyone around the patient. And then there's the financial side of things. Treatment for parathyroid carcinoma can be expensive.
It can. Surgery, medications, appointments, maybe even having to take time off work.
Yeah, it all adds up.
It's a lot to handle on top of everything else.
So it's this combination of physical stress, emotional stress, financial stress.
But it's important to remember, that there is help out there.
Right.
You don't have to go through this alone.
That's so important to remember.
Right.
So where can people turn for support? What resources are available?
Well, first off, healthcare providers are a great resource. They're not just medical experts. They can also provide support and answer questions.
Right. They're part of the team.
Exactly. Don't be afraid to ask questions, share your concerns, talk about how you're feeling. Open communication is key.
Building that trust with your healthcare team can make a huge difference.
It really can. And beyond the medical world, there are support groups specifically for people affected by parathyroid carcinoma.
Well, that's great.
Yeah, it's a safe space to connect with others who understand what you're going through. You can share experiences, get advice, learn from each other. There's something powerful about knowing you're not alone in this.
Just knowing that other people get it, that they've been there.
Exactly. And don't forget about your existing support network, your family and friends.
Right. Lean on them.
Let them help. Don't be afraid to ask for what you need, whether it's someone to listen or help with errands, anything.
Sometimes just having someone to listen, to hear you out, that's all it takes.
Sometimes that's enough. And if you're really struggling with the emotional side of things, consider talking to a therapist or counselor.
That's always a good idea.
They can give you tools to manage stress, anxiety, fear, all of that. They can help you navigate this new reality.
This is about taking care of your mental health along with the physical stuff.
Exactly. They're connected, and both are important. And remember, there's no one right way to cope with this. Everyone's different. What works for one person might not work for another. So find what feels right for you, what helps you feel supported.
It's about self-care, self-compassion.
Yeah.
Allowing yourself to feel whatever you're feeling.
Absolutely. And as we wrap up our deep dive into parathyroid carcinoma, I think it's important to leave everyone with a message of hope.
Yes.
This is a serious condition.
It is.
But there are reasons to be optimistic.
Right. Things are always changing.
Research is moving forward, treatments are getting better, and all of that is giving patients more options and better outcomes.
So to our listener, if you're facing this diagnosis, or if someone you love is facing it, remember that you're not alone. Reach out for support, stay informed, and don't give up hope.
There are people who care, resources to help, and a whole community ready to support you.
Well said. And that brings us to the end of this deep dive into parathyroid carcinoma. We hope you found it informative and helpful. Remember, knowledge is power, but compassion and connection are what help us get through the tough stuff.
Thanks for joining us.
Until next time, take care.